How's it going, everyone? In this video we are going to be talking about how a $2 paper COVID-19 test could help us start reopening schools and other public gatherings so that we can actually begin to return to a more normal life. And the thing to take into consideration when we are testing people is determining, number one, whether or not that person has the ability to infect another person. And this correlates to a number that you hear a lot in the news called the R-effective value. And R-effective is basically the number of other people that an infected person will infect. And so the hope is that if we are able to more widely administer these very cheap and very quick COVID-19 tests to people, the public will begin to be able to return to a more normal state, because we'll know if we're having class that day, for instance, that everyone in that classroom has taken their $2 10-minute paper COVID-19 test and they tested negative, so we can have that public gathering. And so the key thing to make a note of here is that when we're talking about medical testing in general, there's several things that are in a balance and we make some trade-offs. And so in the case of a reverse transcription PCR test or an RT-PCR test, these are considered the gold standard in terms of definitively or conclusively determining if someone has the disease. And with RT-PCR tests, they are quite expensive at about $100. They take from 3 to 9 days to complete, but they are extremely precise. They are extremely sensitive to any remnants of the coronavirus inside of you. And so these are the definitive tests to say whether or not you've ever had COVID-19. The major pitfall here, though, in this is two things. Number one, the precision might be unnecessarily precise for what we really care about, which is whether or not you can infect someone else. And number two is the extraordinarily long time. And by the time we get our RT-PCR test back, which could be anywhere up to 9 days, this person will have been walking around infecting more people. So the test and the results of that test are kind of a moot point at the end of the day. And so what we really need in place is some kind of very cheap, very quick test that will let people know very quickly whether or not you have COVID-19. And if you do, stay home. If you don't, you can go out and have your kid go to school that day. And so what I also like to talk about in this video is how do these tests work, and also why are they not sensitive, but why is that lack of sensitivity not necessarily a problem? And the way this test works is we basically take a piece of paper and we put on monoclonal antibodies onto this paper. So we just stick them right onto this piece of paper, and these things are literally able to be printed, which is the reason why they're only $2 a pop, because it's really cheap to make these. And so you just print out these pieces of paper. They've got these monoclonal antibodies stuck onto them. These monoclonal antibodies will have these variable regions on them that have affinity for some kind of feature on the coronavirus, like the spike protein or the receptor binding domain. And so what's going to happen is that you're going to take a cheek swab, or you can spit onto this piece of paper. And so if there was any SARS-CoV-2 viruses on your spit or in your spit or whatever sample that was just collected from a patient, these coronaviruses are basically going to come along, and then they're going to, on this antibody, stick onto the antibody's variable region because they would have affinity for it. And so basically now what you'd have is the antibody stuck onto the SARS-CoV-2 virus, stuck onto the piece of paper, and then 10 minutes later what we would have is some kind of fluorophore or some kind of fluorescence assay in which we'd have something else come through, and if there was anything bound onto that primary antibody, we can have these things basically stick onto that, begin to fluoresce, and then we would see that clearly you had some SARS-CoV-2 virus present in your saliva or whatever sample, and therefore you're someone who is likely infected by the coronavirus. And so the reason this test isn't that sensitive is that we need to have a relatively high concentration of these SARS-CoV-2 viruses present in these samples in order to have enough to kind of stick on to these antibodies that are on the printed piece of paper, as well as enough to get that fluorescence result. And so, some people will look at this, like the FDA might look at this and say, well, if it isn't sensitive, it's not a really great test because I want to be able to identify 100% of all the coronaviruses present in someone's saliva. I want to know exactly if this person has coronavirus. And so the issue here is that, as you demand these higher levels of sensitivity, these tests become quite a bit more expensive and quite a bit longer to get your results back. And so the other thing that's coming into the story here is the fact that healthcare professionals are beginning to really take a step back and look at whether or not people with lower concentrations of the SARS-CoV-2 virus are even able to infect other people. And so they call this the threshold of transmissibility. And so basically this term that is being tossed around in literature right now and by healthcare professionals is basically defining the limit or the minimum required concentration of coronaviruses that are needed to be present inside of someone to actually have that person be infectious. And so the nice thing here with these paper tests that are extremely cheap is that these paper tests might be just sensitive enough to find that sweet spot to be clearly identifying the people in your population who are actually infectious. So even though we're not identifying 100% of everyone who has the SARS-CoV-2 virus in them, what we are really able to clearly filter by and distinguish people through is whether or not they're able to infect others. And so this makes this potentially an extremely valuable test that we could easily start widely administering to more and more people, millions of people very rapidly. And what we could do in these areas is basically get a bunch of people to start taking these tests and to figure out whether or not they are yes or no infectious. And this would help us greatly reduce the spread of COVID-19. And so this is some excellent news. However, the big drawbacks here and the reason why we're not seeing paper tests take off as much as many of us would hope is the fact that it is not a very sensitive test. What one study found was that the paper test is only 50% sensitive, which means that it's missing half the people who had SARS-CoV-2 viruses as identified by the RT-PCR tests. However, this being said, when we look at the concentration of the SARS-CoV-2 viruses in the patients that the paper test missed, these patients were people who had very low concentrations of the coronavirus, and healthcare professionals believe that in this subpopulation of people that the paper test missed, they were not able to really infect anyone else. And so the huge upsides here are number one, $2 for this test makes it very, very cheap, and we can start producing this stuff like crazy. And then number two is the fact that this test gives you results in 10 to 15 minutes. So that is really, really great because you can know basically every single morning you wake up, whether or not you go to school that day, if you're a kid, can I go to school because I'll have my test results. If I'm negative, I can go. If I'm positive, I'll stay at home. And so this is some really great advances in our testing abilities. And this is something that is a very big area of interest. Abbott Laboratories is one of the companies that is involved in creating these paper tests with the monoclonal antibodies bound onto it. There's a lot of research that is indicating that these things could be potentially a very good way for society as a whole right now to begin to start reopening things in a proper way in which we're able to really know whether or not everyone in a room is most likely non-infectious. And so this is some solid news. Thank you all for watching. Let me know if you have any questions. I'll try to provide links to all the literature and sources for the information presented in this video. And please stay safe, wash your hands, and I'll talk to you all next time.